We begin tonight with the president's sweeping attempt to lower drug prices through executive order. The order he signed today would force pharmaceutical companies to bring costs for some drugs in line with the lower rates other nations pay. Dr. Celine Gounder joins me now. Dr. Gounder, what would this plan do?
So this is called the most favored nation policy. So the idea is that the United States, in particular patients on Medicare, having their drugs covered by Medicare Part B, which, as a reminder to everyone, is the medications you get in the hospital or in the clinic, so it's not everything, but that those medications, the drugs would be priced at the lowest price that any of the high-income countries face. So just to give you one example, insulin, in the U.S., a month of insulin is about $100, let's say. In France, it's about $10, a tenth of what we have our patients paying here in the United States. So that's what we're looking at if this can be enforced.
And would that, but that's a key, the president talked about Ozempic when he talked about this. Would Ozempic be something you would get prescribed in the hospital, or would that be outside of the hospital and therefore not a part of this scheme?
Yeah, so Ozempic would not be part of this scheme. And in fact, the prior administration, the Biden administration, had proposed expanding Medicare coverage to include drugs like Ozempic, and the Trump administration has walked back on that proposal.
So is this practical?
Well, the last time he proposed this in 2020, this was contested in the federal courts and did not hold up. And then you have other challenges. Pharmaceutical companies are among the biggest lobbying presences in Washington, D.C. They are, of course, opposed to this. And then we don't have a centralized way of negotiating drug prices. Medicare is probably the closest thing we have to that, but that doesn't cover millions and millions of Americans.
Another federal program, Medicaid, big cuts in the Republican budget in Congress. What do you make of those?
Well, this could lead to almost 9 million people losing their Medicaid coverage across the country. And in addition, many more having to pay copays that they haven't had to pay before. And a reminder, there's been some discussion of work requirements and the like. But most of these people are actually working or caregiving. So these are not people just sitting around at home doing nothing.